Hello, my wonderful TM joiners. I'm Priya Mistry, the TMJ doc. And today's video is about the anatomical components of the temporomandibular joint, the jaw joints, and how those components relate to the specific signs and symptoms that come along with TMJD. These signs and symptoms include, but are not limited to, clicking and popping noises in the jaw joints, episodes of the jaw locking or catching, crackling noises in the joints, snapping noises in the joints, headaches, jaw pain, ear pain, neck pain, and more. Watch this video until the end to really understand how the anatomy relates to these specific signs and symptoms, and to just learn more about TMJ disorder. It is a condition that can be truly debilitating and difficult to both diagnose and treat. Before getting into it, be sure to check out my other social media accounts. Follow me on there. There's tons of tips, information, and self-massage techniques that can bring you relief today. The links for all of those are below. For those of you who don't know me, I'm a general dentist with a practice in Vancouver, Washington, where we are dedicated to taking care of patients with TMJ disorders. So let's get right into it. First, let's start with basic terminology. Many people will refer to TMJ as an actual condition, and it's not. All it really means is temporomandibular joint or jaw joints. Saying I have TMJ is actually then incorrect, because all you're really saying is I have jaw joint, which is not only grammatically incorrect, but it really just doesn't make any sense. It's actually correct to say I have TMD or I have TMJD. TMD is temporomandibular disorder, and TMJD is temporomandibular joint disorder. Why does that even matter? Well, to me it doesn't, because I know what you mean when you say I have TMJ. But not every provider will know what you mean. Additionally, not every provider will know how to differentiate or distinguish between a muscular problem versus a joint problem versus a combination of a muscular problem and a joint problem that's causing the TMJ disorder in the first place. In addition to being incorrect, I think it's just not specific enough if you say, I have TMJ. Another term I want to go over is reduction. In medical terminology, reduction refers to a body part getting back into alignment. It does not refer to a lessening or a diminishing. Understanding the term reduction is important when I discuss clicking and popping noises in the jaw joints, which I'll be going over in this video. So now let's get more into the anatomy. The jaw joints are made up of two bony components, the temporal bone, a skull bone, and the condyle, which is the little bony knob that our jawbone ends on. The temporal bone has a fossa, a little concavity that the condyle actually sits in. It also has a bony projection called the articular eminence that the condyle actually slides down when we go to open our mouths. When we go to open, the condyle rotates in the fossa and then it slides down the articular eminence. On full opening, that condyle should not go beyond the articular eminence. It should sort of stop where the articular eminence stops. So these are things to keep in mind as we move through this video. Between the temporal bone and the condyle sits a cartilaginous pad of tissue called the articular disc. The articular disc sits on top of the condyle, kind of like a hoodie, and it has medial and lateral discal ligaments that hold it in place. So the proper position for that disc is on top of the condyle, kind of like a hoodie. It shouldn't slide forward or backward. In front of the articular disc is a muscle called the lateral pterygoid muscle. I call this the troublemaker. I've heard it called the terrible, which sounds more like pterygoid, I suppose. And the reason for this is that muscle can cause a lot of pain. So I'll be circling back to that soon. Behind the articular disc sits some very highly innervated tissue called the retrodiscal tissue. The entire joint is then held together by a fibrous capsule. The various muscles of the head, neck, and jaw work together to help the jaw function. All of these muscles are considered a part of the temporomandibular complex and can be involved when there is pain or dysfunction that is present. These muscles include, but are not limited to, the masseter, the temporalis, the lateral pterygoid, the medial pterygoid, the sternocleidomastoid, the trapezius, the suboccipital group of muscles, and more. Now let's discuss some of the most common signs and symptoms that come along with TMJD and how these relate back to this basic anatomy that we've just gone over. I'm a firm believer that knowledge is power, and it's always good to have at least a basic understanding of what's happening when you're experiencing a medical condition, in this case, TMJD. Let's start with jaw joint noises. Clicks and pops, snaps and crackles. Right off the bat, click and pop refer to the same thing in terms of what's happening anatomically inside the jaw joint. When the click or pop happens, what that's telling us is that the little articular disc inside of our jaw joints is coming in and out of alignment, which is often not painful, but it's also not ideal. That click and pop can stay exactly how it is over a long period of time, really many years, or it can progress to the jaw locking closed, which is not a fun thing to go through. This animation shows the disc in the blue. Right off the bat, you can see that that disc is not where it's supposed to be. It is not sitting on top of the condyle like a hoodie. Instead, it is too far forward and in front of the condyle when the mouth is closed and the teeth are together. When the mouth opens, there is a click or a pop, and that's the disc actually getting back in alignment for a moment until the mouth closes again. When the mouth closes, the disc actually goes back out of alignment, often with a soft click or pop. This click or pop on closing is typically not as audible as the one on opening, so it's just not as loud, so many people don't hear the click on closing as much as they hear that one on opening. It's important to note that in this situation, when the teeth are together, that is when the disc is out of alignment. So when the teeth are together, there's a problem in the joint if there's a click or a pop. If there's a click or a pop on opening and closing, this condition is called disc displacement with reduction. That is a fancy way of saying clicking or popping, or that the disc is kind of coming in and out of alignment. Let's break that down. Disc displacement with reduction. This means the articular disc is displaced in the wrong position, but it can reduce, it can get back in alignment for a short while on opening. Let's watch that animation again. You can see when the mouth is closed, the disc is out of alignment. It is too far forward. Then when the mouth goes to open, click, the disc gets back in alignment for a short while. When the disc is back in alignment, when it's sitting on top of the condyle like a hoodie, it is reduced for that time while it's in alignment. When the mouth closes, the disc gets back out of alignment, sometimes with a reciprocal click or pop. To review, this condition is called disc displacement with reduction because the disc is displaced, but it's capable of getting back in alignment for a short while the mouth is open. We've now covered disc displacement with reduction. What about disc displacement without reduction? Let's talk about that. In this condition, the disc is out of alignment too far forward when the mouth is closed. When the mouth goes to open, the disc cannot get back in alignment. It cannot reduce. Therefore, it is displaced without reduction. It cannot reduce, it cannot get back in alignment. Instead, the disc is actually serving as a barrier to opening, and it is during this condition that people can barely open more than 2 or 3 finger widths, and it's pretty painful. The animation shows this perfectly. This condition is also called jaw locked closed. So disc displacement without reduction and jaw locked closed refer to the same thing. And this is a very painful condition during which you can barely open more than 1 or 2 finger widths, and it's accompanied with headaches, jaw pain, ear pain, stuffy ears, neck pain, and more. It's incredibly uncomfortable, and it's often preceded with a history of clicking or popping leading up to the incident of the jaw locking. The reason this hurts so much is that when the disc is displaced without reduction, it's too far forward. And what it does when it moves and gets dislocated too far forward is it pulls the tissue behind it into its position. So that's that retrodiscal tissue we referenced at the beginning of the video. That is incredibly nervy tissue that's now being sandwiched between two bones. So anytime you go to bite, that tissue is really compressed and it sends off pain signals. So that's one reason that this condition is painful. Another reason it's painful is that when the disc is dislocated, the muscles of the head, neck, and jaw go into spasm and they enter a very dysfunctional state. And when the muscles are not in a happy state, that's what can lead to the headaches, neck pain, ear pain, etc. Since we've discussed the jaw locking closed or disc displacement without reduction, now let's talk about the jaw locking open. What happens with that? Well, my friends, that's actually totally different and it has nothing to do with the articular disc. When the jaw locks open, what happens is that the condyle rotates in the fossa of the temporal bone and it slides down that articular eminence like we talked about, but instead of stopping at the end of the articular eminence, it's able to kind of hyperextend and go beyond that eminence. So that's what happens when the jaw is locked open. When this happens, what that means is that on opening, the jaw can actually get outside of the boundary of the jaw joint. This typically occurs in people who have some hypermobility in their joints in general, and they're able to sort of extend past the normal boundary of the joint. For those of you who have gone through this, it is not fun. It is not a fun thing to go through, and the jaw typically has to be sort of loosened up and then manually manipulated back into the right position. Most people that experience this usually only go through this 1, 2, maybe 3 times, and then they kind of learn just to never open that big again. And typically these people are opening way bigger than the rest of us can, which is why they can get beyond the boundary of the joint. So limiting your mouth opening if you are locking open is a good way to prevent it from happening again. Let's move on to crackling noises in the joint. This crackling noise is called crepitus, and it's sort of like a crackly, grainy sound. With crepitus, what's happening is that there's too much compression in the joint. There's just not enough space between the bony components of the joints. This will put a lot of pressure on the articular disc, which sits between those bony components, causing it to tear or perforate. This can then lead to bone-on-bone contact. This bone-on-bone contact can then lead to roughening and breakdown of the bony components of the joints, which will then lead to those crackly noises on opening and closing. Crepitus, these crackly noises, are usually associated with chronic clenchers, people who have been clenching for a very, very long time. That clenching activity will compress the joints even more and put pressure on that disc even more. I am a firm believer that most of us clench or grind our teeth, and any given night it can vary. The force with which we clench, the frequency, and the duration for which we clench. All of those can vary, and they usually ramp up in times of stress. Crepitus is usually indicative of advanced osteoarthritic degenerative changes inside of the jaw joints, which sounds scary, but is common and it's treatable. Keep in mind that these are the most used joints in the body. Just from talking, chewing, and then you throw in clenching and grinding, these joints get a lot of use. Additionally, many of us clench our teeth or grind them without even realizing it. So I would really challenge you to sort of watch yourself during the day when you're stressed, focused, stuck in traffic. See where your teeth are. Many of you will find that you're actually going like this much more than you may realize. The way that this is treatable is with TMJ orthotics. A well-made orthotic by a skilled and experienced TMJ dentist will decompress the jaw joints when you wear it. So space is created in those joints while you're wearing the orthotic. This will slow down the rate of future wear and tear, which could be very beneficial because it could prevent locking or pain in the future. The last joint noise we will discuss is a loud snap, crack, or pop that typically only happens once and is painful when it happens. When this happens, what's usually going on is that a ligament within the joint, typically the lateral collateral ligament that attaches to the articular disc, gets stretched or strained. Because this ligament is stretched or strained, the articular disc can then more easily displace. And this one loud incident of pop, snap, crack, whatever it may be, can then lead to disc displacement with reduction, click, pop, or even disc displacement without reduction, where the jaw is actually locked closed. So that really covers all of the jaw joint noises. If you have any questions, sound off below. Let's move on to the muscles. When there's a problem in the joint, or when the muscles of the head, neck, and jaw enter a dysfunctional state, it can lead to a lot of pain. The way that these muscles become dysfunctional is usually due to chronic clenching, chronic grinding, an imbalanced bite, or injury to the head, neck, or jaw. This injury can be a direct impact or a whiplash type incident. When the muscles enter this dysfunctional state, they get trapped in a chronic pain and spasm cycle that can lead to a variety of symptoms. These include, but are not limited to, headaches, any and all types, neck pain, jaw pain, eye strain, ear pain, tooth pain, numbness or tingling in the face or the fingertips, facial pain, tinnitus, vertigo, and more. These symptoms can be debilitating. I have seen it time and again. I see it every single day, multiple times in my practice. And it can be very difficult to figure out exactly what's going on because there's no testing or scanning or imaging that identifies those dysfunctional muscles. For this reason, so many of my patients go on such a long journey visiting various healthcare providers, from oral surgeons and root canal specialists to otolaryngologists and neurologists, looking for answers as to why they're experiencing so much pain. The upside of seeing different specialists and getting all these scans, imaging, testing done is that it can rule out other conditions like dental infection, ear infections, and even brain tumors. There can actually be a lot of overlap between all of those, dental infections, ear infections, brain tumors, and TMJ, TMD. So lots of overlap between the symptoms that present with all of those. So getting those things ruled out is always great. The discouraging part of all of that testing and seeing so many different doctors for many of my patients is that oftentimes they don't get a clear answer, and instead they're just put on strong pain medication with even stronger side effects. Having no clear reason for pain that can be debilitating can be incredibly discouraging and incredibly depressing for the person experiencing that pain. That is why I have created this YouTube channel, is to get this information out there and to help people who are going through this find the cause of their pain, get that treated, and live their best lives. So that's really it, my friends. Again, I'm Dr. Priya Mistry, and I hope you found this video helpful. If so, please feel free to like, subscribe, and share with your family and friends. For TMJD pain relief from the comfort of your own home, please download my free PDF guide called 3 Steps to TMJD Pain Relief. You can find that on my website. Questions and comments are always welcome, so please sound off below. I'll try to get back to you. I've gotten a little slower at it lately, so be patient with me. And remember, my friends, you can never have TMI about TMJ.